Welcome to New York Nonprofit Media. My name is Jeff Stein, and I'm here with three distinguished guests to talk about their push for the $15 minimum wage for human service sector workers. In particular, here with James Parrott from Fiscal Policy Institute, Allison Sesso from Human Services Council, and Jennifer Jones-Austin from Federation of Protestant Welfare Agencies. Thank you so much, all three of you, for being here.
Sure.
So the first question, broad question that I thought would be good to start with for all three of you is why 15? You know, this is sort of the question that many people have asked. Why this number in particular? Is it just sort of an alliterative call to action, or is there a specific concept behind $15? And you know, why for all workers in the state, and why particularly for human service sector workers? So maybe James, if you want to
Sure.
start with that.
So $15 represents, clearly a significant increase from where we're at now. At the end of December 2015, the state's minimum wage will rise to $9 an hour, and at this point that's the end of the increases, with the exception of the fast food sector, where the governor appointed a wage board that proposed a phased-in increase to $15. So that will start also on December 31st, 2015. It'll reach that level quicker in New York City than in the rest of the state. $15 over a phased-in period of time, so that if it takes until 2021, is what a single adult needs to meet a basic budget in all areas of New York State. The lowest cost area of New York State is the Buffalo metro area. And in 2021, a single adult needs $15 an hour to meet a basic budget. A one or two parent family with children to support needs a lot more than that, but $15 is a good start. It's a significant increase over where we're at now, but it will sort of at least provide a living wage that we haven't had in this state for a long time.
Absolutely. If I may add, FPWA, Federation of Protestant Welfare Agencies, and Catholic Charities of New York City, and the UJA Federation, back in April of this year, released a report that showed that there are 7 policies, anti-poverty policies, that if adequately funded here in New York City could dramatically reduce poverty. Increasing the minimum wage was one of those policies, and we looked at the increasing of the wage to $15 an hour, and we saw that it could dramatically reduce poverty. So that's another one of the reasons why we're looking at 15. And thirdly, the governor himself came out and said that he supported the fast food workers at $15 an hour. He then moved on to say that he was looking to increase the wage across the state of New York to $15, and that he was going to increase the wages of state employees to $15 an hour. And so that also speaks to why we believe we should also look at funding the wages of nonprofit workers who are working for agencies under contract with the state to $15 an hour.
Can you ask specifically about human services workers and why that workforce? Well, our workforce is directly driven, their salaries is by government, because most of the rates that they're paid, the nonprofits, is from government funding sources, with 90% of their dollars coming from government, and half of the workforce is under $15 an hour. And so we are employing a low-wage workforce right now, and that's just untenable. It really creates significant retention issues, and we're talking about people who are working with communities that deal with trauma over and over again, and so when their worker turns over, it just makes the outcomes, getting positive outcomes harder, because you're re-traumatizing people as their caseworker changes, as the people that they go, at the senior center change. You really need to have consistency in staff in this workforce, and so that's why our workforce, we want to make sure gets to that level as well, and also so that we can stay competitive with the rest of the workforce within New York.
And just one more point, just speaking to the workforce itself. Earlier this year, when we were working to move the city of New York to increase the wages paid in contracts to human service workers under contract, with agencies under contract with the city. When together we looked at the faces of these individuals who are making significantly less than what is needed to be self-sufficient, what we found was that they are, in great numbers, women, working women of color with children. And very often they look like the clients they are serving, having a difficult time paying the rent, putting food on the table, and yet working full-time jobs.
So moving a little bit more to the economic funding side of this, your three agencies put out a report called A Fair Wage for Human Service Sector Workers, ensuring a government-funded $15 per hour minimum wage for human service workers throughout New York State. One of the recommendations was the concept of using savings that would be experienced from workers transitioning onto federal health insurance, co-ops under Obamacare. Could you explain that a little bit more to our viewers? It's how those savings would be experienced over time, and also how it would meet the needs of I think your report said $60 million to $75 million in the first year alone that it would cost the government to sort of fully fund this for the human services sector. Where is that offset? And would it be fully funded?
Well, so part of the savings certainly can come from reduced public assistance costs. Many workers in this state are paid so little that they qualify, or a member of their family qualifies for one form or another of public assistance. So as their wages rise, as we move toward $15, the state will experience some savings in reduced payments on earned income tax credit, reduced expenditures on Medicaid, public assistance, and so on. And then in addition to that, there'll be the added economic stimulus of workers spending those higher wages. That will mean that they'll pay more in state and local taxes, more state income taxes, in the case of New York City, more New York City income taxes, and more sales taxes. So there will be some tax revenue income coming into the state along with the phased-in $15 that will help the state afford this. But keep in mind also that this is a sector that's been underfunded for so long. We've been putting increasing demands on the human services sector. Poverty has been very persistent, not just in New York, but around the country. I mean, partly it's a consequence of growing polarization of income in this country. We haven't really sort of owned up to the fact that it requires more public resources to provide those services. And part of it is that we haven't been paying the workforce. This is a workforce that's heavily female, as Jennifer talked about, in New York City, heavily people of color. There's a gender and a race pay equity issue at work here. On the public cost savings side, public assistance cost savings side, as workers' wages rise, they will need to receive less in the way of Medicaid assistance, food stamps, public assistance, and so on. So this will provide some savings in those programs. In the Medicaid area, there's a sizable number of workers in areas related to human services, workers providing services to developmentally disabled, home health care workers. These workers are heavily Medicaid funded. So the savings within the Medicaid sphere will help increase reimbursements in that area. So, it's a combination of savings on the public assistance side, additional tax revenues paid by low-wage workers as their wages rise. And, fortunately, we have a pretty steadily growing state economy. State tax revenues are projected to grow 5.6% this year, for the next 4 years in the 4 to 5% range. The state's in a good fiscal position to do this.
So you mentioned that it's a chronically underfunded sector. I think, Allison, you've spoken about the lack of cost of living adjustments saving the state relatively, $300 million over the last several years. Yep. Given that history, not only with the lack of cost of living adjustments, but also underpaying contracts and paying contracts in a not so timely fashion, what gives you confidence that if you push for a $15 minimum wage, the government won't sort of shortchange the sector in ways that it has in the past?
Yeah, I mean, it's a real concern. There's no question, and that's why we're here talking about it and why we've created the 15 in funding, the funding being key here to the campaign. The government has a responsibility that if they're going to make this policy change, which we are 100% behind, that they're going to fund it. There's no question that the dollars that come from government, and it's both direct state contracts as well as Medicaid rates. There are other rates that are within the system that the government sets. They all have to be adjusted to get there. And this is a policy that's being driven by the governor. So he has a responsibility to make sure that if he's going to make a change, that he's going to fund that. I mean, he's doing it for state workers, as he knows he has to, so it's going to happen for the human services workers. I think it's a false choice to say we should not get behind this because of that. And I have heard, unfortunately, some people who are against this policy using our sector as a scapegoat to say, this is going to demolish this human services sector or nonprofits. They can't afford this. It's going to take them down. And that is just absolutely a false choice. Our sector has to stand up. There's a lot of the reasons that people are at our doors to begin with is because the wage gap is too big, and that people aren't making enough to make a living and to make ends meet. Right. And so we have to support this policy for New York State as a sector, and we have to make sure that our sector is brought along with that and that it's funded. Now, if at the end of the day the governor doesn't do this, we're going to be out there fighting for it, but we're also going to have to sit there and renegotiate contracts. And we do have to realize that there will be real consequences to our nonprofit sector if this isn't funded.
I think it's important that we recognize that there are some nonprofits. It's just not others who are using the sector as a scapegoat. There are some nonprofits who are very much concerned about this increase for all the reasons that we've talked about. But I think that we all have to appreciate, first and foremost, that the reason that we're all in this business is to care for vulnerable individuals and families and to help them achieve self-sufficiency and upward mobility. And so an increase in wages across the state of New York will help to do that. Then we have to look at the sector specifically, and we have to appreciate that it would be imprudent, it would be irresponsible on the part of advocates for the sector and for those who are working in the sector not to push. If we see the wage increased across the state of New York without a funded mandate to accompany it, then the nonprofits are in deeper trouble than they otherwise would be. And so you ask about the feasibility of this. You ask about, whether or not, is there a likelihood it would happen? We've seen that the governor he understands this issue. He understands that individuals and families across the state of New York are struggling to make ends meet. And he's evidencing his understanding of this by one, moving for an increase in the wage across the state of New York, by supporting the fast food workers, by supporting the state employees. We believe that the more that we can do to help demonstrate what is happening with respect to human service employees that are partners with the state of New York in caring for the most needy, that he will be responsive because he sees this as part of his mandate to do more for everybody who's struggling.
Do you think that this has to be a moment where the state revisits contracting, it seems like this has to be taken in a holistic way. Otherwise, they're 15 and funded, as you said. Otherwise, all of those concerns that people within the nonprofit sector and maybe political opponents who are against funding the $15 minimum wage, all of those concerns seem all too easily realized if other aspects aren't dealt with.
So just to speak to that, in January, the Human Services Council is coming out with a report. If you remember, back in March, a major institution, FEGS, went down in our sector, and it was a big moment for our sector. And we can't see more organizations like that and institutions go down, because what will happen is the capacity to provide these critical services that basically maximize human potential for all New Yorkers across the board will disappear. So our capacity to do those services, and these services work in tandem with health and education, they work together to make sure that New York as a whole is prosperous. So HSC is coming out with a set of recommendations in January to talk about this holistic process and figuring out how do we move forward as a sector with government and make sure that we revisit this relationship so that we don't see more closures. This is just one part of the piece of the puzzle, but it's very important. Government does push and how our sector is, and it is a driver of the state of the sector right now.
One of the things that's going to be really important if this goes through, and we really need it to go through, is that the quality of service delivery in the city and the state will improve as a result of this. Now, because wages are so low and contracts are so bare bones funded in New York, turnover is very high. Morale is not, what it should be. Workers are not, they don't have the resources, they don't have the wherewithal to maintain the certifications that they need to provide the highest quality services. They don't have access to support services like childcare to enable them to go back and get a bachelor's degree or an MSW and so on. So, part of what we need to do as we move toward a better funded workforce is we need to think about the investments that need to be made to allow workers to invest in their own human capital skills. That will have important payoffs in terms of improved quality of public services in New York.
Yeah, I just want to add. So the debate is, there are two issues in the debate. There's the debate about whether or not to increase the wage overall to $15. And then there's a debate about if it is increased, should the human services workers working for agencies under contract with the state, should those wage increases be funded? And I think that, first and foremost, you can tease them out. The governor has the authority to act on the government contracts, regardless of what happens with the state legislature with respect to the increasing of the wage statewide. And so we can tease them out and look at them separately. And if we look at them separately, we have to appreciate that the governor can act. And that if he does act, that many, many, many families will benefit. And not just those who will receive the increased wages, but as James just spoke of, those who they serve will benefit from a better quality of services. And then we just have to look at it on the whole as an issue of, what should we, as people concerned about our neighbors here in the city of New York, in the state of New York, shouldn't we expect that everybody can earn a fair and living wage? And shouldn't we all be advocating that everybody is able to better care for themselves and be less reliant upon government funding to take care of them?
So that is a little bit of a politically controversial point, the governor acting sort of unilaterally for the fast food industry and then potentially for your sector as well. Do you feel like it would be preferable to go through the state legislature for all of these changes? And are you optimistic that you can bring along obviously the Republican majority in the Senate to see eye to eye on investing in the sector?
Well, so I'm not going to give your word back to you and say that it would be preferable one way or the other. It needs to happen. We believe very strongly, at FPWA, HSC, the Fiscal Policy Institute, we're all concerned about all New Yorkers. So yes, we are speaking specifically here about human services workers, but we're concerned about all New Yorkers. So we want to see something happen at the state legislature. We believe that the governor can make this happen. We've seen the governor work with both the Senate and the Assembly to make certain things that have been controversial in the past, to see them through, and we believe that this can happen again. And so we're advocating for both. It's not an either or, but whichever way we can get to the promised land, if you will, sooner rather than later, then we're going to do that.
Exactly. We care about the end result, not how we get there necessarily.
Because it does involve increased budget expenditures on the part of the state, though. That is something where the state legislature is going to have to weigh in. So clearly, we're going to be mobilizing to ensure that legislators are well informed on this and that they're supportive of this. As it's been said many times, all politics is local. Every member of the Assembly and the Senate knows of human service organizations in their districts, in their towns, villages, counties, that depend upon state contracts to care for the most vulnerable and to care for people at all ages of their lives, from child care to youth services, after school programs to senior services and so on. So these are services that touch a lot of constituents in every district.
So obviously the governor has the State of the State coming up in just a couple of weeks. What are you all hoping to hear addressing this sector, $15 minimum wage in general? What are you hoping to hear from the governor?
I'd like for him to include the talking point that talks about our sector and talks about its importance to New Yorkers. As James said, it's in every community across the state. We're part of the prosperity equation, and to talk about the importance of our workforce and that there will be a funded $15 increase through the various rates that government supports for human services.
Yeah, the governor has, as I said a few minutes ago, the governor has stepped forward and boldly. You know, he announced a $15 wage across the state. No other, state has yet done that. And he came forward, as we said before, about the fast food wage workers, about the state employees just last week. He took a critical step forward in addressing other needs of vulnerable populations with respect to sanctions that have been imposed on persons in relation to public assistance here in New York City, and he helped many families with that. He's just increasingly showing that he is concerned about making sure that people have enough resources in their pockets to take care of their families. And so we would just be thrilled if in the State of the State he spoke to the needs of the human service workers and the importance of the states stepping up and funding contracts to ensure a $15 wage for them.
Thanks so much, all three of you, for being here.
Thank you.